welcome to HCA Talks Health. I'm Zena le Roux, and today we have Bianca Bloemhof as our guest. Bianca is a qualified biokineticist and a sports scientist, and currently she specializes in assisting professional and elite golfers to enhance their performance and to prevent injuries. So a very warm welcome, Bianca. It's really a privilege to have you on our show today.
Thank you, Zena, and thank you for having me.
Yes, so you help athletes and currently specifically golfers to enhance performance and also to prevent injuries. So I'm curious, please tell me more about how you do that. What type of approach do you take?
So first and foremost, we look at the athlete as a whole. So I always start with a good subjective history. We've got a really good assessment protocol that we follow, where we actually look at the biomechanical aspects, you know, the normal things, flexibility, range of motion, strength, power. But the biggest thing for me, where I get most of my information from, is to actually talk to them and to hear what has their journey been, how did they get to where they are, what motivated them, what's the type of injuries that they've had in the past. And that sort of guides my process further, because you get a lot of information from just actually taking the time to listen to someone's history. So that's always the first, and also just to get an idea of, you know, what do they still need in their game, and what do they expect from me, so that the communication is clear. The biggest hurdle, I think, in general, and especially for me, is communication. Because we as professionals, sometimes we have, we've got a very clear idea of what we're doing, and we know the direction that we're taking, but having really good communication is the best way to get the best out of your athletes. So yeah, that's always where I start, and then I follow a very, very thorough assessment, head to toe. We're trying to figure out, what does the body look like, where is its strongest points, where is its weakest points, and then the challenge, but the exciting challenge, is to also kind of determine what patterns do they show us that has been learned, and what patterns do they show us that is just natural. So there are things that we want to fix and that we can fix, and there are things that are different, but because we work with elite athletes, the difference is sometimes you know, their edge, and it's not something that we want to take away, but actually use creatively and innovatively. So yeah, but starting with a really good objective assessment, getting some numbers there, getting, you know, black and white, knowing where we are at, to determine then a long-term plan of where we will be going from there.
So it sounds like you really take a person-centered approach. There's no one size fits all, and that's where the listening part is so important. You need to listen. Where are the gaps for this person sitting in front of me today, to be able to assist them in the best way possible? But I guess there's only so much that we can do when it comes to the prevention of injuries. And obviously the inevitable is going to happen at some time, and athletes often do get injured. So what type of rehabilitation do you typically use, or is suggested when working with athletes? What are the different elements that you look at then?
I like to rather, instead of focusing on rehabilitation, I like to try and do prehabilitation. So we try to see what type of injuries will the athlete be susceptible to should they stay in the same position where they are at now. Because we work with professionals, for them, having time off because of an injury is a really big problem. It's almost like taking leave for no reason when your leave is finished and you can't. Yeah, so especially with the golfers, it's almost about, when are they going to get injured, and not really the case of if they will get injured. And there are a lot of injuries that are how can I say it? They are more susceptible than another athletic population because of the sustained load of golf. So there are a lot of similarities in terms of load. And so I try to test for it during my assessments, even if they don't complain of the actual pain, we still test to see, are they heading towards a direction of getting an injury? And then the collaboration with a really good coach. I'm very fortunate to work with a coach that has got an exceptional understanding of the human body and how it functions and how important it is to have a body that can actually swing the club instead of the other way around. So then the communication is then back to the coach to see if is the athlete's swing style maybe injuring them? Will it injure them? Apart from performance. So obviously you can't perform if you are injured. So we look at the two simultaneously, preventing injuries, but also what is the easiest way for the athlete to perform without getting injured, because that's most likely also their strength, the part where they are the strongest.
So what are the most common injuries that you see with golfers?
I see a lot of left wrist injuries, especially on the ulnar side. See a lot of hip injuries, especially right hip, right lower back, because of the torque around the hip in the backswing, especially because there's a lot of separation between the upper and the lower body. And I also I'm starting to see patterns of swing styles, and not necessarily swing styles that have been documented in published journals or articles, but specific coaches who coach in a specific way, places a specific stress on specific joints. So that I'm also starting to see. But yeah, most of the injuries is related to the wrist, the hip, and the lower spine.
And maybe if perhaps there are some golfers out there listening today, if given the right approach and enough time, do you find that most of these injuries, something can be done about it, or are there times when nothing can be done?
That's a difficult question. I think there's always something that we can do, but to try and get them to understand the importance of load management. No one's above managing load. And unfortunately, not all athletes kind of understand that. But that's our job, to try and get them to understand that load management is really key, and good preparation. So if you're going to be playing 10 tournaments in a row, you are bound to get injured. Our top level golfers don't even play that much. So and we like to use internet to our advantage, and it's sometimes to our disadvantage, because there's a lot of comparison that then happens. So they'll see Scotty Scheffler doing something in the gym and that looks amazing, and another athlete, but they've got the luxury of convenient travel, in the sense of they're not actually overloading their spines when they travel. They've got good bedding. They're not sitting in economy class and that sort of thing. And also they've got rest periods between tournaments. So, but with us, where we've got athletes that are playing round after round after round, it's quite difficult to manage the loads and give them sufficient strength, power, endurance training. So that balance is very difficult. But managing load in smart ways is key.
Yeah. So what are the most common early warning signs? Obviously, I guess there's an element of pain. But what else? What should people be looking out for as early warning signs to maybe know, okay, I need to manage my load in a better way?
Fatigue, unexplained and generalized fatigue. Early morning stiffness. So where you were able to get up in the morning, go, you're ready, but now you kind of need a little bit of a kickstart, and it kind of feels like your joints need to be oiled before you get going, that's a sign. If you need a more elaborate warm-up routine to feel the same like you used to, that's also a sign. Stiffness is a sign. And also if your swing technique has changed, but it's unexplained, so you're struggling to get into positions where you previously could have, or you're overswinging suddenly, or because pain is not always just related to being restricted. Instability creates most of our injuries that I see, and it's a misconception that if you stretch, you're going to prevent injuries. Sometimes it's actually kind of the opposite. So also, if you can suddenly get into positions that are actually creating inconsistency in your swing, that can also be a sign, but that can be a very early sign, because the instability and the excessive range of motion around the joints eventually creates friction and irritation, and that eventually creates an injury.
Okay, yes. So I guess you kind of go on a journey with an athlete, or you try to support them long term if possible. It's maybe not a once off, or just meeting them once or twice. It could be a longer support journey, if I understand you correctly.
Yes, it's a relationship, and it's also a trust relationship. But yeah, we're here for the long term. No short term goals will suffice.
Yes. Okay, so that's one part of your practice, and I know that you're also focusing a little bit. I don't know if it's still the case, but on chronic pain management as well. So that includes tension type headaches, diabetes, hypertension, fibromyalgia. Is that something that you still do?
I do, on a lower scale, to manage my own load,
yes,
and to obviously attend to the athletes. But I do still help the general population with general pain, and I've vouched myself to still stay in touch with that aspect, because just because we're working with athletes don't mean that they don't have chronic illnesses, don't mean that they don't have chronic pain. And it helps me to obviously pick those little things up that a general physical trainer, for example, might not be able to pick up because of the experience. So, and I enjoy it as well. It's very fulfilling to walk a journey with someone that has been riddled with pain, and now suddenly they can actually live, a quality life. So, I do still do that, but on a lower scale.
So how do you support people to manage their pain? Because in some cases, I think it might feel like a life sentence to live with chronic pain. So how do you support them?
Yeah. Yes. So encouraging them is key. To try and focus on the process where we are going towards, instead of the place where we are at now, and to actually listen to them. So a lot of these chronic pain patients just need somebody that they can vent with, that will listen to where are the pain coming from. And something that I've seen is many people suffering from chronic pain don't have anyone to talk to, because it's almost the only thing that they kind of talk about. And so they eventually stop talking to the people around them, so they don't have a support system anymore. And sometimes medicine don't always explain our pain, and it's not always psychological. It's just that the reason and the underlying cause hasn't been found yet. So that gives them a lot of hope to know that there is still someone. They are still looking at the reasons why I do have pain. So it again goes back to actually listening to the person that is in front of you. I've had many people that have suffered for years with pain, and they've had a diagnosis, but just an easy, quick diagnosis, because it's so multifaceted and it's so complex that it hasn't been investigated thoroughly. But once you get the right team who actually does the investigation, for them, then having a diagnosis is so freeing. You would think that someone that's been suffering from pain for a long time find a lot of relief from having a diagnosis, because again, it gives them hope, and there's a plan, and there's something that we can work on. And yeah, but I do have to say, I've worked with chronic pain patients, especially people with autoimmunity, and they are the most wonderful people. They are so courageous, they are so strong. It's to me, it's always it encourages me as well to just do better, because if this person in this much pain can do it, then surely I can handle whatever stress I have.
So it could be quite inspirational.
So it's quite very inspirational and very fulfilling. Yeah.
So it really seems like you do take a multidisciplinary approach. You don't just look at one area and that's it. You listen. Just by listening to someone, you bring in a whole other dimension. So do you believe? It seems like you do, but I just want to hear more about that from you. So do you believe obviously in a multidisciplinary approach to health?
Yes, I do. I think if anyone could do it all, there wouldn't have been so many degrees out there. That you actually take a lot of time to grasp the underlying knowledge. So no, I'd 100% make use of a multidisciplinary approach. And I think that the clients that you work with actually also appreciate that. And I think working with a human being is the most complex thing that you can ever do. Pain in itself is so multifactorial. I mean, you've got the nervous system affecting pain, you've got the brain affecting pain, you've got your psyche affecting pain, you've got your past experiences affecting pain, stress affects pain, and so we've got different disciplinaries that are better equipped to deal with different aspects. So I do take some time to understand, what others do out there, what I cannot do for them.
Yes.
And steering them in the right direction is wonderful.
I think that's very important for most health professionals out there to realize that, I can't do it all. And taking hands with other professionals could be the best solution for the client that you're working with, to really provide them with answers and hope eventually on their healing journey. So where can people find you?
They can contact me on my phone. I do have to say WhatsApp is the easiest because we don't always have signal if we travel. We don't put our phones on roaming. And then emails is not readily available to me. So I'm the easiest to contact. If you don't find me when you phone me, then if you just pop me on WhatsApp, then I'll get back to it.
Wonderful. And the name of your business?
BioGrit.
BioGrit. Okay. If anyone wants to Google it, do you have a website currently?
We do have a website, and the general information is all on there as well. Yes.
Okay. Thank you so much, Bianca, and thank you for your wisdom and your advice. I think it's really valuable, and I really like the approach that you take, looking at the person as a whole, not just focusing on one area, but really including all these different factors and elements that could be adding to the pain or the injuries. So, thank you so much. If you have a passion for health and wellness, and you would like to make a difference in the lives of others and discover a new rewarding career in health and well-being coaching, visit www.healthcoachesacademy.com to find out more.